next pandemic strikes, Americans will again depend on senior health officials to steer the nation's response and reassure the public. But the team Trump has assembled is largely untested, possesses scant infectious disease expertise, and has often questioned vaccines and other interventions overseen by the agencies they have been tapped to lead. Michael Osterholm, an infectious disease expert who advised President Biden's transition team, tells The Washington Post, when we get into another firefight with a microbe, we need all hands on deck. We need the best science and the best public health practice to come forward. I'm not confident at this point that this administration can do that. Joining us now, Advancing Health Equity founder and CEO, Dr. Uche Blackstock. Good morning to you, Dr. Blackstock.
Good morning, Dr. Blackstock. So we had former Congressman Tim Ryan on just now referred to a lot of weird stuff with RFK Jr. in this health team that the incoming president's putting together. When you're looking at this assemblage of folks who I would argue are misaligned with the mission of caring for our nation's healthcare, what are some of the concerns that are top of mind for you when you're looking at not just a potential microbe that may, disrupt things a year from now or 2 years from now, but just setting all this up and going through what they're saying they're going to do? What does it make you think?
Right. Yeah, so I'll just step back a little bit and say that when you look at our public health infrastructure compared to other high-income countries, we have a long way to go. And so the fact that we are putting folks in these leadership positions who have very little clinical experience, research experience, or even governmental experience makes things very, very concerning for me. I think when you look at these picks, they are a mix. Some are more concerning than the others. Some have served in Congress. Some are practicing physicians, but others have no public health background at all. And they're leading agencies that make decisions about our vaccine immunization schedule, that approve drugs. And so I think we have to step back and look and see, what's going to happen and how can we mitigate the potential harm that these picks pose.
There is this from the Washington Post. Trump's former FDA commissioner warning that RFK Jr. could, quote, cost lives if confirmed. We're going to start seeing epidemics of diseases that have long been vanquished, and God forbid we see polio reemerge in this country. He said, here's the thing. I think there are a lot of people who do like the idea of tackling chronic health issues and reorienting the system to that. That does not need to be at the expense of ignoring infectious disease or ignoring the science. It would seem there actually is an opportunity to balance both.
No, absolutely. And when you compare us, again, to our peer nations, we have the highest burden of chronic disease. We could be doing so much better. I don't think it has to be mutually exclusive. We can still be ready for the next pandemic, and we still can have systems that function in a way to improve health outcomes like chronic disease, diabetes, high blood pressure, obesity, right? But the question is, what are we going to have to do in the next 4 years to make sure that both those landscapes are covered?
So you have on Twitter, for example, the former Surgeon General Jerome Adams making note of vaccine confidence needs to stay high. Whooping cough cases up 5 times this year, 100,000 global measles death, mostly in kids. H5N1 steamrolling toward pandemic status. Egg prices skyrocketing. This gives you this sense of what's coming. When you have someone in mind to run an organization like our healthcare system who says, back in 2013, that the CDC's, fascism is basically fascist and liking vaccinating children to abuse by the Catholic Church. And I'm sitting here thinking to myself, well, that's not healthcare policy, that's fanaticism.
Right.
How do doctors and researchers And those in the medical professions and in the research area, I have a niece who's in the research area and in biology, and their concern is a genuine concern that not only does it impact the science, but it impacts the resources that you need to do the science.
Right. And I see it as, you know, what happens on a systemic level in terms of policies, but what also happens in terms of how these leaders are influencing trust in institutions. So this whole issue of vaccine mistrust, we saw it, you know, rear its ugly head in 2020. And we know that a lot of people don't have faith in our institutions, including our healthcare institutions. I do think this is an opportunity for researchers, clinicians, physicians like myself to really speak to the public in a way that they get it. And I say this because I don't think we've always been great about this. We are in our silos. You know, we saw in 2020, 2021, a dynamic situation with COVID-19. Things were changing day to day. It was information overload. This is an opportunity for us to think about how can we translate what we do in our exam rooms, in our research labs. How can we communicate with the public in a way to make them understand and to gain their trust?
But a lot of that comes down to money, right? I want to be clear. I think the other thing that's important to understand is a lot of these folks are going to manage budgets, and they're going to decide how money gets spent. And if you want to continue to be competitive when it comes to these vaccines, if you want to continue to have high levels of access, then it also matters that it remains a priority.
Oh, absolutely. And I think this is, you know, for this, the Senate will confirm some of these picks, right? I think it is on us to make sure that these senators truly understand what could be done if these folks get confirmed. I think that we need to make sure they understand, you know, the impact. So RFK Jr. said that when he comes into office, that he is going to fire 600 NIH employees, right? And who else is going to come in those places, right? But these are people, these are careerists, people who have been in the NIH for a very long time. They need more funding. They need more support. They don't need to be replaced.
Yeah, so if you're firing these 600 people who are doing research at NIH, who's going to do the research?
Right.
Or are you just now abandoning the research altogether?
Right. Exactly. Or reprioritizing what is important, right? Or what you think is important. So that shift from infectious disease to chronic disease, like we talked about before, that's not necessarily a bad thing, but we can meet in the middle. Right? I do think that there is an issue about transparency. And one of RFK Jr.'s concerns is this relationship between the healthcare industry, pharma, and the FDA, right? How can we really make that more transparent for the public so they understand, like, you know, what is happening? So I do think this is an opportunity for us to do better about informing the public about these relationships.